Welcome back to Beyond the Stethoscope, a series where we highlight the great things providers at Trinity Health Mid-Atlantic are doing to create a healthier community across the greater Philadelphia area. I'm your host, Adrienne Kiss. We are so excited to welcome you to our new season by introducing you to Trinity Health Mid-Atlantic's new regional president and CEO, Dre Boyd. He started with us earlier this year and comes with a wealth of knowledge and a vision to bring new light and leadership not only to our hospitals, but to our greater community. Dre, thank you so much for joining me today.
Thank you.
Thrilled to have you here. And well, first off, congratulations on your sort of new role.
Yeah, appreciate that.
Yeah.
Thank you very much.
I'd love to hear a little bit more about your background to get us started, if you don't mind.
Yeah, I don't mind at all. So again, I'm excited to be here with you today. I'm a Southern kid, so originally from New Orleans, Louisiana. It's my hometown. I've been affiliated with healthcare a long time. My adoptive father was a physician, and so I've been around the profession for a very long time. Wanted to be a physician like him and chose to kind of go into a different direction in healthcare administration. I've been a part of healthcare administration for about 22 years now. Started out working for the VA as an intern in Washington, D.C., and then subsequently got a great opportunity with a system called Wheaton Franciscan Healthcare in Wheaton, Illinois. I was based in their Southeast Wisconsin market for about 5 years. And then I got my first clinical operations opportunity actually with Trinity Health in their Maryland market. I was the business administrator for surgical services at Holy Cross Hospital for about a couple of years. And then I got the call to join HCA as in their Chief Operating Development Program. Fast forward, worked for another faith-based not-for-profit after that, and then for a public health system in Miami, Florida called Jackson Health System. And then following that, I worked for New Hanover Regional Medical Center, which is part of Novant Health in North Carolina. And then prior to this current role that I am with Trinity Health, I worked for the Christ Hospital Health Network, which is located in Cincinnati, Ohio. So been around for a while, worked for faith-based not-for-profits, for-profits, public health systems. And so I've seen all the gambit of healthcare.
Yes, you have. You truly have.
Yes, very much so. Very much so.
Wow. So it just seems to be in your DNA. You have the family background of working in health. That's incredible. What drew you to this specific role?
Yeah, I think first of all, the mission. The mission of Trinity Health and Trinity Mid-Atlantic is one near and dear to my heart. Just to give you so early on in my career, in my life, I grew up in inner city New Orleans. And so I had a grandmother, her name is Joyce McFarland. And, most of her life, she took care of me. Her max income ever was $17,000. And so for us, we kind of use the ED as our primary care and et cetera, which is probably not the right way to use.
But it's so many people do, right?
Very much so, because it's more about not having the healthcare literacy to understand what the proper way to get primary care in your community. And so, but fast forward, this Elkins family, I think I shared with you a little bit, my Elkins clan. They came in New Orleans. They made me a part of their family. And then I got to see healthcare in a different mindset. Again, one exposure from my adoptive father, Thomas Elkins, who was the chair of OBGYN at LSU. He got me exposed to what healthcare really is and how you provide healthcare in the right place at the right time for the person and when they're needing it. And so with that said, I believe the mission of Trinity has allowed us to be able to take care of all, regardless of ability to pay versus the ability of your access challenges that you may have. That what drew me to the role. In addition, as I stated earlier, I was a part of Trinity Health back in the early 2000s, working at Holy Cross Hospital in Maryland, and I got to meet some great leaders. And so leadership development and the experiences I've had during that process allow me to be excited about joining Trinity again, because Trinity has some wonderful executive leaderships, team members, as well as some wonderful leaderships that across each of the ministries that we cover. And then the other big part is, again, this is an exciting time. I don't know if anyone shared with you, but, the Trinity Health Mid-Atlantic legacy, I call it legacy for Philadelphia and Delaware, we are now unified with the Maryland market. So that opportunity to use synergies between both markets to help grow and advance our ministry of healing health, as well as service and community health within all the markets that we cover is very vital, and I'm excited about that journey.
Yeah, it's incredible. You summed it up so well. And like I was saying earlier in our introduction, this is our exciting to launch this brand new season. But in our past season, I learned from surgeons, from other administrators, how important it is to kind of meet people where they are. And that's a theme that I'm picking up from you in a leadership role. And so it's just incredibly powerful seeing that it kind of, I don't know, it just threaded throughout every service that Trinity Health provides, meeting people where they are. So I would love to touch on what you kind of mentioned about your childhood and then what, Dr. Elkins brought to you, like that idea of health literacy. Do you want to expand more on that and maybe how you feel in your role that you could help the greater community, like with their
that's a
health
great,
literacy?
thank you for asking me. I think for me, again, there's communities that are underserved that if they understood the fundamentals of basic care, some of the ailments and some of the issues that they have would help them, and we can alleviate some of those issues.
Yes.
And so it's important with some of the community health work that we do here in Philadelphia, as well as in the Maryland market. We go out where the patients are. We have some focuses on, especially at our Nazareth and Fitz campuses, as well as St. Francis. I don't know if you heard about, and I believe Lil came here before, about the Healthy Village concept.
Yes.
To bring, again, services that are really touching the community where they need it the most. And same thing in Maryland. Maryland has some health centers that they focus on specifically for the underserved and the population that need primary care the most for that market. I think the other part about health literacy is us giving opportunities around education, community outreach, community service events that we do for both markets, and we try to focus on ways to attach that patient population as much as possible. The other thing is we try to provide collateral and information in our clinics that allows patients to get more information that way, and then just specifically have a better strategic mindset about population health as we move forward with that specific population going forward.
Absolutely. I mean, it just keeps everybody healthier, right?
That's correct.
And I love that, like you said, just giving them the information they need when they come to see you. So then hopefully in the future, it's less ED visits and better for the greater community health overall. So Dre, as you shared with me, you are fairly new in this role, even though you've quite the resume and you've accomplished so much already. Do you want to highlight for me and for our viewers your priorities as you continue on in this role?
Yeah, thank you for the question, Adrian. I think for me, I've been here for about 3 months now, and it's been wonderful to focus specifically right now on the people. I've been getting around touring at each of the facilities, getting to know our providers, our colleagues, and our leadership team, and the wonderful things that they've been doing for our community overall. I think a big focus also my first 90 days has been focusing on our strategic plan and strategic priorities for our service lines as we try to grow within our markets that we cover. In addition, how we partner with physicians. Yeah. That's another important priority for me as an organization, our independent providers, as well as our employed physicians, making sure that they feel that they have the resources and the support by our team members to be able to do their job very efficiently and effectively for our patients every day. I think the last specific priority in my first 90 days within my role is to make sure that we can help the community understand how committed we are to the community outreach and community priorities, and making sure that we can elevate the health of the communities that we serve by providing knowledge, literacy, collateral information for them, as well as giving them the right tools that they need to be able to take care of them and their families.
I love that. So every visit is more fulsome than just treating what they came in for. You kind of want to provide them with all those resources to help them in the future.
Yes, that's correct. Thank you very much.
That's amazing. And with all the travel you're doing, I hope you're taking some time for your own rest. Because that's a lot of travel.
It is. It's funny you say that because, I was telling the team and some of the providers that, over the last 15 years, I drank a lot of energy drinks and I'm a big Coca-Cola guy. But usually every night I don't go to bed until like 12 o'clock at night, and then I get up every morning at 5 o'clock. I've been doing that for 15 years, but I'm always excited about the day. in what we do, because I get to be in a job that is about people and taking care of people every day. Making sure when they come to us sick, we heal them, we help them. I'm not doing it directly. I'm doing it through others. I'm making sure that we provide the resources necessary for our providers to take care of our patients and our clinicians to take care of our patients. But being able to do that it excites me every day.
That's amazing. Wow. Going on 5 hours of sleep.
Yeah, it's been fun.
Being president and CEO, it's really impressive. I'm going on 5 hours of sleep, but it's because I have
for
a
different
4-month-old.
reasons. Yeah, congratulations.
Thank you.
You're welcome.
It's nothing like what you're doing. Well, as we wrap, because we've touched on so many things, the community and kind of meeting people where we are, that theme that I've picked up obviously from you and a lot of your colleagues. Is there anything else you want to add about just this common thread between, because I know you serve Bucks County to Delaware to Maryland at this point, the greater Philadelphia area, that common ground, I would love for you to touch on that.
Okay. I think the commonality and the common ground is ultimately it's about the patient.
Yeah.
Fundamentally, it's about how we take care of our patients. Now, again, each hospital has a uniqueness to it because of the people, because of the community, because of the culture of that specific location. Yeah. But ultimately, one patient, one time, take care of them, right place, right time. In addition, the common ground is our mission. Yeah. Overall, Trinity has a wonderful, powerful mission that we cover multiple states across the United States of America, and it's as evident in the Trinity Health Mid-Atlantic region as any other region that we cover from a ministry standpoint. And so I think those are fundamental common things that we do. But then the last thing is being the provider of choice for our providers. Again, physicians are the individuals that make sure that we operate effectively as a healthcare institution. And so we have to make sure that we are providing the right tools and resources for them to be able to do their job every day, the right team members, the right colleagues to be able to do their job every day. And so I think that's a common thread through all of our hospitals within the Trinity Health Mid-Atlantic region.
Oh, that's amazing. That's so inspiring. Well, I wish you continued success, because that mission is just incredible, and just what you're able to do in serving the community. I know it's going to be really awesome to watch you and the entire team continue this work.
I appreciate it.
Thank you so much.
Thank you.
So if you would like to learn more about Trinity Health Mid-Atlantic and some of the great community work Dre spoke about today, please visit the link in the description below. Please like and subscribe to Beyond the Stethoscope to see new episodes every other Thursday.